What's going on, guys? In this video, we're gonna talk about SIGA Technologies. Once again, that's SIGA Technologies with the ticker symbol SIGA. Guys, in this video, we're gonna talk about the current news regarding monkeypox, and we'll try to actually dig down deeper and find out about SIGA Technologies. Okay, guys, if you like the information and analysis I'll be providing in this video, please hit the like and subscribe button. Let's get going.
Victoria's first monkeypox patient remains in a stable condition in hospital as the World Health Organization confirms at least 100 cases have spread across a dozen countries. But infectious diseases experts have told medical reporter Emily Rice there's no need to panic.
Sneaky viruses like COVID are so dangerous because they spread before the infected person even feels sick. But monkeypox only transmits when people are symptomatic, so it's easier to trace and isolate.
Clearly, this is not COVID. It's a very different virus. It's a very different disease.
Emily Rice, 9 News.
So guys, this is the first article that we're going to talk about what we know about monkeypox and how it's different from COVID-19. So this is an article from Yahoo Finance. Okay, Saturday, May 21st, 6 a.m. That's 2 hours ago. So no cases have been yet detected in Arizona, but scientists are keeping an eye on monkeypox, a viral disease related to smallpox that has recently been found spreading in North America, Europe, and Australia. So it says here, guys, a traveler returning to the United Kingdom from Nigeria was found to have the disease in early May, and since then, other cases have been observed in Britain, France, Spain, Italy, Canada, and several other countries. A Massachusetts man was confirmed to have the disease this week, and health officials are investigating another suspected case in New York. The World Health Organization on Friday, which was yesterday, called an emergency meeting to discuss the outbreak. While the researchers have studied monkeypox for decades, some are surprised to see the appearance of the disease in so many different locations. So guys, I'm reading this article to you guys just so you know, it's really sad what's happening in the world, because I hope this is not true. My hypothesis is not true, right? But there could be something going on. Like I hope it's not biotech warfare or some kind of warfare that has something to do with medicine, right? So they give this kind of disease because they already found a cure for that. So we've seen that in movies many times now, and I hope that's not what's really happening. So it's really sad. Anyway, it says here that in this particular case, we've never really seen one outbreak really being connected to multiple continents. So it looks to me that this specific case came from one country during a trip, a visit. So right after that, it could be in this is just how I look at it. It probably came from a visit or to some country, then it's starting to spread. So hopefully, guys, right, everybody will be safe. But let's like I said, the purpose of this video is to take a deep dive into monkeypox, right? And of course, the stock associated with it. So what is monkeypox? It says here, monkeypox is a rare infection, and it's described as zoonotic, meaning it's normally seen in animals. However, the disease can be spread to humans from an infected animal if you're bitten or touched by its blood, body fluids, spots, blisters, or scabs. The infection is a member of the same family of viruses as smallpox, although it's much less severe. It's not common for monkeypox to spread from person to person, but according to NHS, it can be spread through touching clothing, bedding, or towels used by someone with a monkeypox rash, touching monkeypox skin blisters or scabs, coughs, or sneezes, meaning it can also be transmitted with bodily fluids. According to the NHS, a rash will usually appear between 1 to 5 days after infection, and generally beginning on the face before spreading. The rash is sometimes confused with chickenpox. It starts as raised spots which turn into small blisters filled with fluid. These blisters eventually form scabs that later fall off. Between 1 and 21 days after infection, you may experience the following symptoms. So, high temperature, headache, muscle aches, backache, swollen glands, shivering, and exhaustion. All in all, symptoms can last around 2 to 4 weeks. So, how is monkeypox treated? treatment takes place in a specialist hospital to prevent the spread of monkeypox. There's no single cure for monkeypox, so treatment is largely focused on relieving symptoms, including lowering your temperature, easing pain, and taking antibiotics to help fight the infection. Now, the most important part here is there a monkeypox vaccine? Although there is no specific vaccine for monkeypox, a vaccine used against smallpox, a more severe virus which has since been eradicated, is said to offer some protection. Now guys, with that being said, FDA approves smallpox drugs also believed to be able to treat monkeypox. As global cases of the rare virus grow in the US and Europe, the FDA has given the green light to the IV version of TPOXX, a smallpox drug that can be used to treat monkeypox. Many smallpox drugs are used to treat the rare virus as there are no therapeutics tailored specific to it. The US has confirmed one case of monkeypox in Massachusetts, and New York City officials announced a second suspected case on Thursday. In total, the virus has been detected in 11 countries across North America and Europe. So, the Food and Drugs Administration has approved a new drug for monkeypox treatment as cases of rare virus has been detected in 11 countries in the US and the UK. SIGA Technologies, based in New York, announced Friday morning it had received the regulatory green light for an IV formulation of TPOXX in a smallpox drug. The company notes that in Europe, the drug is officially approved as monkeypox treatment. So guys, I strongly believe that this will send the stock flying. Okay, the company notes that in Europe, the drug is officially approved as monkeypox treatment as many smallpox drugs because of the similarity of the viruses. The drug is added to doctors' arsenal as the rare yet potentially devastating virus continues to spread around the world. So even here in Canada, guys, there's a case regarding monkeypox, having been confirmed or suspected in dozens of cases in 11 countries across Europe and North America. So these are the places, guys, where monkeypox has been detected. So yeah, Canada, US, France, Portugal, Spain, Italy, Germany, Sweden, and Belgium. And a pill version of TPOXX, a smallpox drug believed to be effective against monkeypox, has already been approved by the FDA. The IV version will add to physicians' arsenal in fighting against the emerging virus. Of course, guys, what drives the stock price also has something to do with supply and demand. So if since TPOXX, oral TPOXX, is the first drug approved by the U.S. Food and Drug Administration, okay, like I said a while ago, this stock will go and will start flying like the Novavax situation during the COVID-19 pandemic, right? So, like I said, yeah, hopefully, okay, this is not something, like I said, this could be a worldwide problem, but hopefully that's not the case. But the purpose of my video is to actually send out the word regarding the monkeypox, right? And also to give you an idea what SIGA Technologies is. Okay, SIGA Technologies that has been surging recently. Okay, so SIGA Technologies, guys, the stock price of this last Friday when they got the award, right, from the FDA approval. I mean, from the FDA and the US, when they got the green light, it went flying from so let's go to the summary here. Okay, so this is the one day, this Friday. It started at $9 and it ended in 12:40. So in after hours, it went from from 12:40 all the way to 15:33. Okay, so which is really cool. But if you go on a 5-day, okay, this just started at around $7.37. But as soon as the monkeypox news started coming out, right, the stock started flying. So of course, guys, it's not the retail investor that initially got the news, right? Definitely it's the insiders or the lobbyists, right? So they're the ones who are able to place their orders first for the stock before the retail, of course. Also, guys, you can clearly see here that this is the one day chart of SIGA Technologies. Even if you go to this is the daily. Okay, so if we zoom out, okay, so definitely, guys, as you can see, okay, this is So SIGA Technologies has been in this price range before, but like I said, the stock is actually flying because of the news, okay, the sentiment. Now, although it's been in the stock price before, I strongly believe that this is a no man's land, right? And people will keep on piling up on this specific stock on Monday, or it's like a multi-day bagger, okay? I'm not trying to pump this stock, okay, guys? I'm just letting you know that there is a stock that is named SIGA Technologies, and this stock will definitely fly because the monkeypox is still out there, okay? So definitely it's not been rolled out yet, okay? The TPOXX is not been rolled out yet, although it is there, it has the approval. So since there's a demand, okay, and the supply is not that big, and there's not a lot of production with TPOXX, definitely this stock will 100% fly. I'm not trying to pump the stock, that's just my personal opinion. Guys, if you like the information and analysis I have provided in this video, please hit the like and subscribe button. Once again, this is your boy Don Leo Trades. I love you all, stay safe out there, peace out.
Hey, we're not done yet. George has got one too. Mr. Tillis joins us. Not exactly the most fun one to end on, George. There's something called monkeypox going around, but apparently traders have found the stock that might be able to save us from it.
Well, yeah, it's one stock out there, SIGA Technologies. It's actually trading quite a bit higher in the after hours again today, which was up already about 50% in the last few days. But this is actually a small cap company with a market cap of about 530 million, but they actually have a license for a therapeutic to treat smallpox, which I had to look at myself, is actually a milder version. Monkeypox is actually a mild version of smallpox. So we know that is becoming an issue. But for SIGA Technologies, one of the things about it is it's actually grown in terms of sales because smallpox, which has been eradicated for about 40 years, treatments and therapeutics for smallpox are being accumulated by U.S. governments. Both the U.S., Canada, and of course the U.K. have been acquiring treatments and therapeutics for smallpox based upon precautionary measures, just in case, of course, smallpox makes its way back into the hands of those perhaps that are going to be utilizing it for biological warfare. So if you look at SIGA Technologies, they actually secured a couple of catalysts this week. One is they actually received FDA approval for not just the oral therapeutic or pill that they already have in the marketplace, but for an IV-based version of their therapeutic to deal with symptoms of smallpox. But the other thing is the Department of Defense actually secured a contract with them to purchase 7.5 million units of their particular drugs going forward up until 2024. So this is a company that I think has gotten some traction since COVID, because if you look at their sales number, which has grown about 4 times since 2019, is a situation where we see precautionary purchases of therapeutics to deal with things like smallpox, and that's why the stock has been higher. But it also has received FDA approval for that, like I said, IV therapeutic for their particular drug as well.
Okay, so the idea that maybe they could apply some of this technology adapted to the need at hand if it becomes one.
That's correct. And one of the things I will mention about the company itself is the news this week is a catalyst. I think the monkeypox also, because there's a balance between those two, smallpox and monkeypox, are very similar in terms of the family of viruses they come from. That's another catalyst. But the other thing is it's a very profitable company. The company itself is expected to grow its total revenues about 300% in the next few years. This is based on that DoD contract. The company generates about 50% net income margin. So I think that in of itself is a primary catalyst to see the stock continue to the upside. But you also have to think about some of the risks, which are, again, it's not commercially utilized. In other words, it doesn't have clinical application in the private sector. It's more used for precautionary measures by governments and, of course, in this case, the Department of Defense.
Okay. George Tillis, not the happiest subject for us to end on, but a good one to keep our eyes on. Mr. T, appreciate your help this week on the earnings and the overlooked stocks. Have a great weekend, George.
You too.
Next up, we got big earnings next week.